So I grew up in Long Island, New York, and was there until I was 18 years old when I left to go to college. So that's a really good question. So I actually went to college at Penn State, and I went in for computer engineering and computer science, and did that for 3 years. And I haven't told this story in a while, but took an early introductory to psychology course, like one of those classes that everybody has to take to be just more exposed and well-rounded. And I'll never forget, the professor came out, Dr. Cornwell was his name, like a skinny, bald guy, and he had, it's gonna sound a little funny, but in a container of formaldehyde, actual human brain. And we spent like 3 days on the central nervous system. It was a super introductory. If I looked at that book now today, I would laugh at how basic it was probably, but I was just completely blown away with the similarities of the way the brain worked, or at least the way they explained how it worked at that point, with the connections and the information coming in, and how information was filtered, and the motor pathways and how that worked, and how similar it was to how computers worked. But at the same time, I realized how much more complicated the brain was than any computer that existed then or even exists today. And I literally changed from computer engineering, computer science into pre-medicine that semester, and made that transition. Took some extra classes to catch up. But in all fairness, at that point, I just knew that I wanted to be in the neurosciences, which could have been neurology or neurosurgery, and I wasn't really sure at that stage which I was going to really pursue. So I was in medical school and did some rotations. I did a rotation with a group of neurosurgeons up in Philadelphia, and I loved them. I loved the guys. They were super hardworking, super proud of their work ethic, and quite honestly, they worked harder and longer than anybody that I'd ever met in my life to that point. And I think it was at that point when I said, like, this is the kind of guys or kind of people that I want to be like. We really clicked and just had similar passion for the way we wanted to do things. And that was it. I think that was the moment where I said, I think I found people that are kind of how I am and kind of how I want to be. I came to Charleston actually to interview for neurosurgery. So I did my residency at MUSC. And during that process, when you're in medical school, you apply to a bunch of different programs, and then you get invited to come for an interview. And Charleston was one of the sites that I got invited to come interview at. And I came down here, and it was the first time I'd ever been to Charleston, and actually remember going on a horse and carriage ride downtown, which was amazing. But even more amazing was that night. I'll never forget it. I think it was very fortunate. They were having a little get together at one of the restaurants downtown that's not there anymore, and they invited me to go, and of course I was like, yeah, of course I'll go. This is a wonderful opportunity. And so I went, and I just remember parking my car on the side of East Bay and walking down the street, and like there was like gas lanterns and the horses going by with the buggies, and the whole entire place felt, for lack of a better way to say it, very, I want to say European. It was the most European city that I'd been to, and quaint and historic and charming, and just like a great place to live. And so that really endeared this place to me. And then also when we do our residency, which is a 7-year process, I wanted to be at a place where I can invite friends and family to come down, and I knew that they would have a good time even though I was stuck at work, that they could still go to the beach or go downtown or do something else. So for me, it was the perfect marriage of all those things, and that's why I chose to live here afterwards. I think we all care a lot about, I think almost every physician cares a lot about what they do, how they do it, wanting to do it well. And I don't know it's hard for me to answer in the context of what makes me different, because I don't know everybody on that level, in all fairness to everybody else. I would just say that, the thing that I'm honestly most proud of is I'm always thinking that one day I'm going to be that person, I'm going to be that patient and sitting on the other side. And if the roles were reversed, what would I want this experience to be like? If I had to go see somebody who knew so much about my problem and I knew so little about it, which is a very vulnerable position, how do I want to be treated and spoken to when I find myself in that position, which eventually we all do at some point in time. And then if not me, then what would it be if it was a family member? So I want to be the doctor, and always wanted to be the doctor that I want to send my mom to. The one that if she had this person as a doctor, I would say she's got a great doctor. And that's sort of like the litmus test that I apply to myself. So whenever I feel like if I'm in a rush or we're running behind and it's so tempting to want to speed things up, you got to say to yourself, well, this person's got this visit, this is their time, and so you just have to give them as much time as they need to feel good about that experience. So to me, that's the way I've always been. That's how I remember talking to my wife about that way back when we were dating a long time ago, about how I saw my interaction with people, and I don't plan on that ever changing. There's a lot of amazing moments, truthfully, because we deal with, chronic things that sometimes somebody's been dealing with forever, and then when you properly identify it, properly fix it, it goes away, and all of a sudden what was, 5 years of misery is gone in 1 hour of surgery. That's pretty amazing. Then you have, truthfully, we do trauma stuff. So somebody comes into the hospital, is in a bad car wreck and has hemorrhaging in their brain, and you take them to the operating room and do this really complicated, procedure where you're drilling off part of the skull and taking the blood out. And then to see that person get better and come into your office or come back to the hospital and thank the nurses that took care of them when for a while they were on a ventilator and you weren't even sure if they were going to get better. And knowing that you literally change somebody else's life, and then multiplying that by all the different people whose lives you've changed in a meaningful way. I think for me, even though in the middle of it, it's hard to get your mind around it, but I think one day in the back end, you'll look back and you say, hey, I didn't change the world maybe, but I changed the world for some people. There's one patient that I was talking to somebody about the other day that he couldn't lift his foot. He had a herniated disc and a dropped foot, and we took him to surgery and did a 45-minute small surgery where we took that herniation off of the nerve. And in the wake-up area where he was still coming out of anesthesia, he's just looking at his foot, moving it up and down, and just giggling because he can move his foot again. And, again, we didn't save his life; it was a foot thing, but it makes all the difference in the world. And so to see him have that much improvement that quickly was honestly amazing for me, and I think equally amazing for him.